and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions to their acute and chronic medical needs. We do this through primary care, COVID-19 testing, COVID-19 vaccines, as well as concierge medicine and telemedicine. Good afternoon, ladies and gentlemen, and welcome to Let's Chat. This is our makeup edition of Let's Chat from yesterday. We're traveling and are out of town, and I thought it would be good to remind us of some of the benefits of vitamin D. Vitamin D is coming up more frequently in conversation as a supplement that helps to fight off disease, and I should say a vitamin and not a supplement. Sometimes you need supplementation of vitamin D if you have a deficiency. So let's talk about that. And I wanted to talk about some of the surprising benefits of vitamin D. One of those, the first one, is weight loss. Vitamin D helps with weight loss. There are studies that have shown when comparing a group of individuals that are trying to lose weight, they compared a placebo group of individuals that were not on a vitamin D regimen to a group of people that were trying to replace their vitamin D, and they're on vitamin D and calcium. And it found that those individuals that were supplementing or replacing their vitamin D and calcium lost more weight than those individuals who did not. So that's one benefit, surprising benefit and very good benefit of vitamin D. The second is going to be that vitamin D helps to fight disease. Vitamin D has been shown in several studies to be very beneficial in helping to fight heart disease as well as fighting the flu. We know most recently its affiliation with COVID-19, and that people that are deficient in COVID-19 seem to be more susceptible to COVID-19. People that are deficient in vitamin D, seem to be more susceptible to COVID-19. That has brought it to the forefront as being a vitamin that we need to make sure that if you have a history of vitamin D deficiency, that we treat that, okay? There are a lot of patients, and I have a lot of patients who will have a vitamin D deficiency and will replace it, and sometimes because it's a vitamin, we kind of don't think about that. We're like, it's just a vitamin. There's so many different benefits of vitamin D. Two things that I immediately think of are that number one, and that is that someone who is deficient in vitamin D puts themselves at greater risk for fracture if they were to have a fall. That's just sharing with you just a little bit of some of the things that happen with people that have a vitamin D deficiency, or the things that can happen. So it helps to fight disease. We know it helps to fight heart disease. It helps fight the flu. We know that people that are deficient in vitamin D seem to be more susceptible to COVID-19 infection. Another reason we want to make sure that we definitely treat a vitamin D deficiency. Third benefit we want to share with you today is that vitamin D has been shown to have a place with cognitive decline. It's found that people, and this is something that will be discovered as we get older. We talk about when people are early age of 65 and we start thinking about dementia or memory issues. One of the things that has come to the forefront is that people that are deficient in vitamin D seem to be more at risk for cognitive decline. So that's yet another reason, doing it now for later on in life, that we want to make sure that we replace vitamin D if we need to do so. Okay? Now, it just would have it that I'm actually outside, relaxing on a little vacation with my family, and of course thought about vitamin D because it's so important. It's harder for us as African Americans to metabolize and make vitamin D. Vitamin D is made when we absorb sunlight. It allows our bodies to make vitamin D. It's naturally metabolized through our bodies. So because we're outside today, we're going to get some vitamin D. But guess what we're going to do? We're going to make sure that we put on sunscreen. And I want to dispel a myth here. Sometimes I know that there's a myth, African American people do not get cancer, don't get skin cancer. That simply is not true. It's very much a risk for us as it is for other cultures. So we need to make sure that we sunscreen up, even if you're one of those people that's like, I never go to the beach, I'm hardly out in sun. You just want to make sure you go ahead and utilize that sunscreen. And again, to review that, those three benefits of surprising benefits of vitamin D. Number one, helping with weight loss. Number two, helping to fight disease, including but not limited to multiple sclerosis, heart disease, flu, COVID-19. We could go on and on about the benefits of helping to fight disease with adequate vitamin D. And then lastly, we talked about us utilizing vitamin D in preventing cognitive decline at a later point in life. So we want to make sure that we remember that. So if you're not sure about your vitamin D level, and let's just take a page here. We talked about actually this morning on CBS News, we talked about what time of year it is and what kind of things that we should be doing. If your parents out there haven't made your physical exam or annual wellness exam for your child, please make sure that you go ahead and do that. It's very important. A lot of children missed their wellness exams on last year due to COVID-19 and due to the pandemic. So we need to make sure that we get these kids caught up so that they're caught up fully on their vaccinations. And part of us making sure that we get kids vaccinated and be on time deals with the same breath as the same way that, parents protect children, right? We hold their hands when they cross the street. We make sure that they don't do things. We buckle them into their car seat to prevent accidents. This, making sure they're up to date on their vaccinations, is the same thing. So there are diseases that childhood vaccinations fight off, including, but not limited to, influenza, polio, like all kinds of diseases. And so very important to make sure our kids are caught up on those. Lastly, but not leastly, if you're out there, and this is all I had to share with you guys today, but if you're out there and you are not vaccinated, well, first of all, if you're not vaccinated, please get vaccinated. The numbers of COVID cases in our state, in the state of Alabama, are rising. As we well know, we anticipate that the Delta variant will be the major strain that's causing most of the COVID cases throughout our state, probably within the next week or so. And what that means for those of you that are not vaccinated is that you are at very large risk of getting a COVID-19 infection because the virus is extremely contagious and spreading very rapidly throughout our community. So if you're not vaccinated, I encourage you to go ahead and get vaccinated. If you have questions about that, talk to a healthcare professional that you trust so that you can get your questions answered. If you're in need of COVID vaccines, we provide those at our office. Our number is 205-291-8842. We have Johnson & Johnson as well as Pfizer. Different people have different things they want to do. Some people just want the one shot. Some people prefer to have the Pfizer. Having either of these vaccinations provides you with protection against COVID-19 and decreases the risk. It does not 100% prevent you from getting COVID-19. There's nothing that can do that, but it does provide you a largely decreased risk of getting the infection, as well as the severity of disease and the decreased likelihood of death and intubation if you were to get a COVID-19 infection, okay? So if you're not vaccinated, please get vaccinated. Now, people that are not vaccinated right now should be still wearing masks. They should still be being socially distant. They should definitely still be making sure that they wash their hands. I'm going to take it a page further. There are no guidelines, and let me make sure I say this first. No guidelines have changed, to my knowledge, with the CDC guidelines at this point. I, however, am encouraging my patients to go ahead and adopt those things that we know work, vaccinated or not. If you are vaccinated, there's certain environments that right now I would not go to. I'm being very careful about different places that we go. I'd be very careful about who you attend meetings or any indoor meetings and places that you go with other people right now, because there's such large numbers of the virus circulating in our community at present. And then lastly, I would make sure that I wore a mask around other people that were outside of my family, and if I was unsure about their vaccination state. And I know that the mask thing it's been politicized. There's a lot that people say about it, talk about it. People have different emotions about it. It's this simple for me, and I try and explain it to patients in this way. A year ago, when we were first quarantined and everyone had to be away from their families, right? Everyone had to be away from their families. We all had to stay at home. We would go out to go to the store, pretty much everyone was quarantined. From that moment, in the last 12 months, there have been two major incidences, I would say, and let's say the last 14 months, two major incidences that we've seen a drastic decrease in the number of cases of COVID-19. Those two things are, number one, is when the mask ordinance was instituted and when it was required that everyone wear a mask. So we know that mask wearing decreases the cases and decreases the risk of spread of COVID. Very simple thing to do to help decrease the spread of this virus throughout our community and help protect our state. Second thing that happened is the vaccinations. So it's really that direct. If you're not vaccinated, please get vaccinated. Number two, and let me go ahead and dispel a myth. I know that I've seen on social media people have asked this question. Well, Dr. Celeste, I've heard that people that get the vaccine, some of them are getting positive with COVID. The same way when you get a flu vaccine, that you can still get the flu. It's dependent upon to. It also depends. It also depends on the amount of viral antigen that you're exposed to. It also depends upon the how close you are from that person that was positive, how contagious they are, how much you're exposed to them will help determine whether or not that's an infection that you could get, because there are people that are around people that are positive for COVID that don't get it, right? And we know that the vaccine helps. The way that the vaccine helps is that it has taught your body how to develop an antibody that recognizes that spike protein. So when it comes in contact with that viral antigen, when it comes into your body, it tries to get rid of it. So at minimum, someone who's vaccinated is going to have a decrease in any viral load simply because they're vaccinated and they have antibodies in their body that help them to recognize the virus. So that's the one reason why we want to make sure that we definitely get vaccinated. We want to make sure that we do the mask wearing, because mask wearing has shown to decrease the number of cases of COVID-19 and helps protect you from other people immediately around you, as well as to help protect those individuals if they're mask wearing as well. So I encourage you guys to think about that. If you have any other questions, issues, if you're in need of COVID vaccine, whether Pfizer or Johnson & Johnson, you can give us a call at 205-291-8842. We're offering vaccines Monday through Friday, 8:30 until 4 p.m. If you're in need of COVID testing, we're continuing to offer COVID testing, both rapid COVID testing as well as standard PCR testing that typically takes 24 hours to come back. I hope that you don't need a COVID test, but if you need one, we'll be more than happy to service you with that. That's all I had to share with you guys today. I hope everyone stays safe and healthy and get some vitamin D, but make sure you put on some sunscreen before you do. Again, just a reminder, I know we went off on a little tangent, those 3 hidden surprising benefits of vitamin D: helping with weight loss, helping to prevent cognitive decline, and helping to reduce disease. I hope everyone has a great day. Again, I'm Dr. Celeste. I'm your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions to their acute and chronic medical needs. We do this through COVID-19 testing, COVID-19 vaccines. We do this through primary care, as well as concierge medicine and telemedicine. Have a great day, everyone, and please stay safe. And if you're not vaccinated, please help to protect our state and please get vaccinated. Have a great day.